Hi, my name is Shanna Ryan, and today I'll be giving a presentation on the topic of strokes. What is a stroke? A stroke is a medical emergency that occurs when blood flow to the brain is blocked. It is the leading cause of disability in the United States. A stroke can be classified in three different ways: an ischemic stroke, which is the most common form, and this occurs when there is a blockage in the blood vessels to the brain, which can potentially stop the blood flow to the rest of the brain, resulting in potential brain damage. A hemorrhagic stroke, which is more severe, and this is when the blood vessels carrying oxygenated blood to the brain rupture, or a TIA, also known as a mini stroke. This is when blood supply to the brain is briefly blocked, but it does not cause permanent damage. This type of stroke can also be a warning sign that a more dangerous stroke may occur. Signs and symptoms. An acronym to help determine if somebody is suffering a stroke is FAST. This is if they are suffering from facial drooping, arm weakness on either side of the body, and speech difficulty. If you see somebody having any of these symptoms, it is important to act fast and call 911. Symptoms may vary depending on the location of the injury to the brain and the damage of the nerve function. Some symptoms include dizziness or problems with balance, fainting, severe headaches, nausea, trouble walking, or confusion disorientation. A stroke is the fourth killer and number one cause of death in the United States. Every 40 seconds, somebody suffers from a stroke, and every 3 minutes and 14 seconds, somebody dies from a stroke. There are complications that can occur depending on the damage that was done. Some complications include decreased cardiovascular fitness, fatigability, impaired circulation, osteoporosis, dysphagia, which is difficulty using the muscles in your throat to swallow, and aphasia. Aphasia is where your speech is affected, and there are two different types. There is receptive aphasia, where an individual may have trouble understanding and processing what is being said to them, and expressive aphasia. This is when an individual may know what they want to say, but they're having trouble forming the correct words or expressing what they want to say. Some long-term effects that may occur include visual perception damage, short-term memory loss, impaired emotional functioning, or change in personality. And this is because having a stroke not only can potentially damage your brain, but it is a really traumatic event. It can cause depression, anxiety, increase irritability, sadness, and it's important that somebody who has suffered a stroke has a really good support system, and if needed, is seeing somebody for help. Weakness or difficulty moving one side of the body might also occur. Speech and language difficulty, as I previously mentioned, and fine motor skill trouble. There are risk factors when it comes to a stroke, and there are some risk factors that can be changed and treated, but there are also risk factors that cannot be changed. Some of these risk factors that are manageable include the use of birth control, diabetes, excessive drug or alcohol use, high blood pressure, heart disease, obesity, and lack of exercise. Some factors that cannot be changed include a person's age. People who are over the age of 55, this increases your chance of having a stroke. Gender, more men suffer from strokes, however, more women than men end up dying from a stroke. Genetics, race, having a stroke is more prevalent in African Americans and also Hispanics. And also, history of a prior stroke does increase your chances of another stroke occurring in the future. There are several different ways a doctor can diagnose if somebody did have a stroke. A CT scan is pretty common, and this can be done with contrast or without contrast. A CT scan is beneficial because it can show bleeding in the brain and can help doctors to view the blood vessels in the neck and brain. Another way to diagnose this is an MRI, which can detect brain tissue that was damaged. An echocardiogram or an ECG may also be used. An echocardiogram uses the sound waves to create detailed images of the heart, and this can help to find a source of the clot. An NIH scale is also used, and this just is for doctors to determine the severity of the stroke. So on the presentation, I have the scale, which is just different topics ranging from a scale of 0 to 3, And at the end, the doctor or nurse will tally up that score between 0 and 42, and depending on the range, that helps to determine how severe the stroke was that occurred. The effect of a stroke on exercise response. A stroke, as you know, can affect multiple body systems, and exercise therapy is very beneficial, but only after the patient is medically stable. Their oxygen uptake might also be reduced, and exercise can help regain mobility and strength in the body. Passive exercises are very beneficial for those who may have paralysis on one of their sides of the body and can also be used to treat muscle spasticity. Management and medication. Depending on the type of stroke that somebody may have suffered, there are different ways to manage this and also different medications that may be given. If someone were to suffer from an ischemic stroke, drugs that destroy blood clots, aspirin to prevent more blood clots from forming, and TPAs, liquefied clots, are all very important. For somebody that had a more severe stroke, antiplatelet drugs are beneficial, and coils might also be placed into the arteries that burst. A comprehensive plan of care, including exercise, diet modification, cholesterol-lowering medications, and aspirin, can help lower a second stroke by up to 80%. Therapies might also be needed, and this can include physical therapy, speech therapy, occupational therapy, cognitive therapy, as well as behavioral therapy. Exercise testing. So with a stroke, fatigue is very common, and also previously mentioned, it is common for a patient to be taking medications. So this is something that you want to take in as a factor while completing an exercise test and writing an exercise prescription for the patient. And you should also accommodate an individual's physical impairment. There are two main ways that someone might assess a patient who dealt with a stroke. And a treadmill test is beneficial at a slow speed, but only if the individual can stand and demonstrate sufficient balance. Exercise prescription in a patient who suffered a stroke. So there are, like I previously mentioned, many benefits in exercise therapy, and exercise training can help improve exercise capacity 10 to 20%. During this, there are 3 different phases of exercise. There's acute, which occurs in the hospital, subacute, which takes place in the rehab facility or home, and maintenance, which occurs at the home. And all of these are very important in the recovery of a patient. Also, aerobic, resistance, and flexibility training are all very important, and with the main focus on aerobic training. Aerobic training is beneficial 3 to 5 times per week with a 40 to 70% of heart rate reserve. Resistance training is beneficial at least 2 times per week with 50 to 70% of the 1 rep max. Flexibility training is recommended 2 to 3 times a week, but completing flex stretches daily is more effective. You want to have the patient stretch to a point of slight discomfort and feeling of tightness, and holding each stretch for 10 to 30 seconds. So here I have my case study. Robert is a 37-year-old male who was brought to the emergency room after an onset of left side weakness, speech difficulty, and confusion. During the initial physical exam, it was noticed that the patient was suffering from severe expressive aphasia after having trouble reading what was in front of them. Robert also presented with left facial droop and slurred speech. A head CT without contrast was ordered and showed indications of an ischemic stroke. On the NIH scale, Robert scored a 14, and this indicated that he did suffer a moderate stroke. Also, during the assessment, his past medical history was given, and it was noted that he has a history of migraines. He does suffer from diabetes and high blood pressure, and he indicated that he does not engage in tobacco use. However, he is a light to moderate drinker. His BP at the time was 129/90, and Robert has a BMI of 26.8 kilograms, putting him at the overweight category. Goal setting. Client's why. So the client, Robert, he is married with 3 kids and a full-time job as a financial advisor. Given his age and his BMI, outpatient therapy as well as lifestyle changes are recommended to help recovery and prevention of another possible stroke occurring. So this might be increase in exercise, diet modifications, increasing his sleep, reducing salt and sugar intake. Some short-term goals include outpatient physical therapy, occupational therapy, and speech therapy. Physical therapy will be beneficial for Robert to help regain strength on the left side of his body and decrease muscle spasticity. Occupational therapy is also recommended to help improve use and feeling in his left hand, since Robert has noted that he has trouble handwriting and with fine motor skills. Speech therapy will also be needed in recovery to help fix his severe aphasia. Some of Robert's long-term goals included diet modifications, limiting saturated fat intake, as well as salt and sugar intake, continuing with the exercise prescription prescribed to him, and at least 30 minutes a day of walking outside 5 days a week. And this is just to help his overall sense of well-being. And Robert would also like to return to work and leisure activities, whether it be golfing on the weekends, spending time with his kids and wife. So the table is the exercise prescription written specifically for Robert to help him recover and get back to what he was before the stroke. So we want to mainly focus on aerobic exercise and also resistance and flexibility. So initially, aerobic exercise is recommended at 3 times per week with a 40-60% of heart rate reserve. You would also recommend to do this 30 minutes per day, but his duration of this can be broken out to multiple 10-minute sessions per day. And using a treadmill in physical therapy or any use of a cardio machine with a physical therapist initially is recommended. As Robert moves to the maintenance phase of exercise, 4 to 5 times per week is recommended with a 60-70% of heart rate reserve. It is also recommended that he completes his aerobic training 30 to 60 minutes per day, and this can be done through outdoor walks or if he feels comfortable using a treadmill at the gym. With resistance training, it is recommended that Robert engages in this 3 times per week with a 50-70% of 1 rep max intensity. 2 to 3 sets of each exercise with 8 to 12 reps or until failure will also be beneficial. Initially, when he is in the acute phase, just completing some strength training exercises in a seated position with light weights is recommended. And as he progresses in his recovery, various exercises in seated and standing position is recommended and increasing the weights used. Flexibility training is also an important component in his recovery, and this is recommended at 2 to 3 times per week. However, like I mentioned earlier, daily is more effective. When it comes to intensity, stretching to a feeling of slight discomfort or tightness with 3 to 4 reps and a 30-second hold with each stretch. And Robert can complete various static and dynamic stretches. So in conclusion, I went about this kind of a different way and wrote about why this topic is important to me. So I ended up choosing this topic for my project because of the significance it has to me. This time last year, I suffered from a stroke that left me with severe weakness on the left side of my body. I had severe left arm muscle spasticity as well as my gait. I could not walk straight. I had to use a cane to help walk, and I also had an arm and knee brace. And it also left me with severe aphasia. I would have trouble processing information, being what was said to me, and it would also take me a while to communicate and get out what I was trying to say to somebody. It also left me in the 10th percentile cognitively for my age. So again, somebody could ask me to go do something or grab something for them, and as somebody who now is recovered, I would understand what they were saying, but during that time, I could not process what was being said to me. And this was obviously very difficult because I was a senior at the time, so I had to put school on hold, and because of it, I did not graduate on time. Going through this during my senior college brought up a lot of emotion, and despite my challenges, I decided to stay positive, and this whole experience left me with the mindset from I have to I get to. I find myself a lot of times saying I have to go to class, I have to go to the gym, I have to get this done, where in reality, we really don't have to do anything. We choose to, and also we were lucky enough to get to. There was a time in my life where I couldn't even walk up my steps. So now anytime I'm going to the gym, I'm saying I have to go to the gym, I get to, because I was lucky enough to recover, but there are millions of people out there who will never recover. And I think as people who are relatively healthy, it is very selfish of us to not push our bodies to the best of our abilities and to really go out there and try every day. And when you have almost everything taken away from you, you begin to really appreciate the simple things in life. I mean, I was 21 at the time, and my roommates used to have to cut my food up for me so I did not choke, because I suffer from muscle weakness in my throat, and also because I forgot how to use the knife. So occupational therapy, that helped me with the use of knives, stepping out of a bathtub, etc. Stroke recovery is not easy at all. It is mentally and physically draining. However, having a strong support system and also therapists in the initial phases of recovery are extremely, extremely important and can help the patient make a drastic difference. Unfortunately, not everyone is going to recover, get back to 100%, and I was very lucky to have. And I really credit my therapist and my friends, my roommates. I was able to still live at home, and they did do a lot for me, but by sticking to my normal routine and still trying to engage in conversation and still trying to walk up my stairs, walk down the block, I believe it really helped my recovery time versus if I stayed in an inpatient rehab facility. I think for my mental health, being in a positive mindset, that was very ideal. So yeah, this was a very important topic to me just because of the relation I have to the topic I chose. And here is just listed some of the references that I used for this project. I hope that everybody was able to learn something new about strokes today.